Welcome everybody. This video is about the increasing costs in the healthcare sector and the challenging and the future direction of the entire healthcare sector. So first of all, we have to consider that worldwide in the last 10 years, all the costs and the budget and the expenses of the healthcare is growing worldwide. So it's not just matter of European country, United States or Asian. It's a problem that is correlated at the global level. So we have to understand first of all why this cost is increasing, because the problem is that the costs and expenses and the budget of the healthcare sector is increasing faster than GDP growth, is increasing faster than inflation, and is increasing faster than any costs on different public sector. Of course, we had to figure out which sort of nation country we're talking about, because every country have different way how to finance, how to impose their budget on the healthcare sector. For example, European country, Australia, New Zealand, Korea, Japan have a very high percentage of public health care compared, for example, to United States. But anyway, also United States, where the share of the private care, of the private hospital, anyway, also in United States, the public health care expenses is rising constantly. We figure out and we try to focus the attention in European country where there is a general attitude to provide the healthcare services at public level, and the share of private is completely low compared to the share of the public healthcare services. Because the private, of course, work and act as a company, so they have different way. Their aims is not just to provide services to the public, but is also to generate some economic benefit. But we'll focus on the public healthcare. So the first reason is that the increase in population, the population aging. It means that, for example, in a European country, we have less births and the population continue to get older and older. It means, of course, you can imagine the old people need more services compared to the young people. Another problem that affects the rising cost of the healthcare is, for example, starting from the pandemic of the COVID-19. So we have in the last 2 or 3 years, an increasing cost. So you can imagine that moving from treating, for example, in Italy, an average of 10.3 million people per year, we have to treat the entire population for the vaccination, for the people that get sick, for the virus of the COVID-19 and so on. This is impose a huge cost in the healthcare sector. Another recently problem that affect the increasing cost is the Ukrainian war between Russian and Ukrainian, because of course the Russian almost close out all the natural gas that reach the European country. So imagine that, for example, a country such as Germany, they import almost the 70% of the entire natural gas. Why is important this aspect? Because all the healthcare sector, in particular the hospital, are very high energy intensive activity. So the increasing cost that it becomes 3 times higher compared to the previous one impose a higher cost to the entire budget of the healthcare. Another important aspect is the inflation, because especially after the starting of the war in Ukraine, the European country, they saw that the cost of the living cost is continuing to rise, but it's also increasing the cost of all the medical devices, the medicine, any sort of services and goods that the public health provides to the population. So there are several reasons why this cost is rising. One of the most important, if we see on medium long term, is the aging population. Also the migration, so the people not just that transit into the European country, but also the people that remain in European country. Most of them, they reaching our country in a very bad health situation, and they need more treatment. So there are several reasons why this cost is continue to rise. Another important aspect is also the fact that the awareness of the population due to the digital devices, due to the more information, they increase the demand of the services to the public health care in terms of preventing this sort of disease, in terms of increasing the number of the medical examinations such as X-ray, TSC, and so on. So there are several aspects that continue to impose the increasing costs to the healthcare sector. And of course, each country, they have some specific budget. So what's going on? That this matter is translated into the fact that the government cut some expenses to avoid that the rising costs are out of control. This is translated into the fact that we have less medical personnel, such as doctors, specialists, nurses, and so on. And this is translated, as you can imagine, to the worsening of the public healthcare services in terms of long waiting lists, in terms of reducing number of beds per hospital, and so on. So this is a very challenging for the healthcare sector because every country has some specific budget. We cannot go over this budget, and this is, of course, affect the quality of the healthcare sector. So how we can, in some way, try to manage this cost and to get, in some way, the public healthcare sector more efficient from the technical point of view, from the economic point of view. So first of all, we had to see how we can, in some way, increase the efficiency from the technical medical aspect. So, for example, reducing the medical error represents one of the first way how we can reduce the error, how we can reduce the number of the customer treated. Also reducing the antibiotics, the inappropriate use of the antibiotics, because this represents another aspect that if some specialist or some doctor using inappropriate antimicrobials, in some way the customer, the people, get sick again and again, so this increasing the number of the treatment. Another factor is also the variation of, in some way, the practice, the medical practice. It means we had to increase the way how the GDP collaborate with, for example, the hospital, the entire healthcare sector. This is just some technical aspect from the medical point of view, how we can increase the efficiency, how we can reduce the number of the people treated. Then we have all the economic aspect. Of course, how we can increase the efficiency, the technical, in economics we call the technical efficiency. So how we can, with some specific budget, provide more services, more treatment to the to the customers, to the population. So increasing the productivity, it means, for example, using less materials, because there are another problem correlated to the healthcare. This is the waste of a huge amount of goods and services to provide some specific operation or some specific treatment. So reducing the overuse of medical devices, increasing also the efficiency of the medical devices. So, for example, running any sort of medical examination during the weekend, during the period when we have less demand. So we can increase in some way the efficiency, the productivity, for example, of the hospital. And another revolution that we see in the last 5-7 years roughly is the digitalization, what is called the e-health. So the digitalization gives us the possibility, if we interconnect the entire population to the healthcare sector, to the GDP and to the doctors, to have a huge amount of information that represent a very intensive way how we can increase our services, because it's quite easy now with any sort of digital devices such as laptop, mobile. We can interact with the healthcare sector, we can share the information, we can avoid the fact that every time the patient had to reach the hospital, had to reach the doctor. So the digitalization represent one of the most revolutionary way how we can increase the healthcare services, the healthcare goods, but also how we can, for example, imagine during the COVID-19, if we can contact the entire population, how we can reduce the wasting time of the people that should reach any sort of healthcare infrastructure just for running examination. So we can plan at national level the entire services, avoiding the wasting of time, the wasting of money, and in some way we can manage in more productivity and in a more efficient way the entire healthcare sector services. Thank you very much.